talking about the latest Lassa fever outbreak in parts of the country now. The Nigeria Center for Disease Control has declared an outbreak of Lassa fever and activated an emergency operations center to coordinate the response.
Now, this follows an increase in the number of Lassa fever cases reported from several states since the beginning of the year. The Director General of the agency, Chikwe Ihekwazu, reveals there are 60 confirmed cases with 16 deaths recorded. He advises the public to focus on prevention by practicing good personal hygiene and proper environmental sanitation.
A few 16 deaths so far in among 60 confirmed cases. So 16 deaths in 60 cases. And the reason why people die from Lassa is basically late presentation. So we've been very proactive this year in educating healthcare workers and educating people that, listen, if you have a febrile illness or features of fever, once you've done a rapid diagnostic test to rule in or out malaria, once it's not malaria, don't keep taking repeated courses of antimalarials. It might be something else. We have laboratories now that can make the diagnosis. We have 4 labs across the country. Last year, we had only 2, so we spent the last 8 months developing 2 further labs. We can collect a sample from every state capital in Nigeria. You don't have to do anything. Your healthcare professional needs to call the NCDC. We'll arrange for the collection of that sample to one of our labs, do the testing. If it's positive for Lassa fever, get into treatment early.
Right, joining us is the Chief Medical Director of Rufeka Medical and Dental Hospital, Professor Joe Nigbinde. Good morning.
Good morning.
It's good to have you join us.
Yeah.
Right.
We also have the Deputy Director of the Prevention Program Coordination, NCDC, Emmanuel Agogo, joining us from Abuja. Good morning, and thanks for joining us.
Good morning. It's a pleasure to be here.
Yes. Let's begin by, not taking it for granted that everybody understands what Lassa fever is. Maybe you want to tell us exactly what it is and how it presents. This is, of course, for you. Yes. Emmanuel.
Yeah, hi, Ngozi. My name, Lassa fever is one of the conditions which falls under viral hemorrhagic fevers. It's caused by a virus which was discovered for the first time 50 years ago in Lassa in Borno State. We know that it's caused by that virus, and then we know that it's transmitted through one of the rats called a multimammate rat called Mastomyces natalensis. It's found in Nigeria. It's found here. And we know that the feces or the stool of this rat, if it contaminates food, drink, or if humans come in contact with contaminated feces or urine, they are exposed to this virus. We have also known that it presents in a way that is similar to a lot of the other conditions that we have, like malaria. We talk about typhoid. So it might start with a fever, aches, pains, a lot of joint aches and tiredness and a high temperature. However, when you get quite advanced, you would find that it affects the body's ability to clot, for blood to clot, and therefore you start having bleeding. So bleeding from various orifices, bleeding from the nose, the eyes. You could also have a period that becomes extremely heavy. So these are some, and it also predisposes women who are pregnant to abortion as well. So this is a bit of information about Lassa fever and how it presents.
Okay. Let me bring Professor Nigbinde in here. 50 years after detecting Lassa fever in Nigeria, we still have the outbreak in parts of the country. One would say, is Nigeria really learning lessons from Lassa fever? After all, Lassa fever even started from Nigeria, was detected in Nigeria in the first place with the name Lassa and all of that. Have we learned any lesson? Is Nigeria just sitting down and waiting for people to die and not doing anything or something 50 years after?
Well, thank you for having me. You've said it all. It is unfortunate that Lassa fever was fully described in 1969 in Nigeria. And for 50 years, we've not found solution. So at least it is practically impossible to eradicate Lassa fever. but it can be prevented. Much more could have been done about it. It's unfortunate. I listened to the director of NCDC saying that we have 4 diagnosis centers across the nation. That is too poor as far as I'm concerned. Very, very poor. 36 states, you have only 4 diagnosis centers, and there is only one research center that I know of in Nigeria that actually doing research about Lassa fever, which is at Yerua in Edo State. This is very, very poor. The reason is that we are not taking our health care very seriously in Nigeria. We're playing with the people's health. Funding of health is is abysmally poor in Nigeria, and I think we have less than 5% of the budget.
All right. What usually happens when, because 2018 was recorded as one of the peak point, where the highest of all times we've had cases of Lassa fever, but the period between the outbreak and then the intervention, and then it disappears, and then it comes back again. Yeah. Well, what's the difference in that gap? What gives at that point where we don't have cases of Lassa fever and then it comes back again?
See, Lassa fever comes most of the time during the hot seasons, usually between January and April. Yeah, because the rodents that are hosts usually run out of the bushes and finding safe havens. And that is why, maybe that's why you have a short break between that time and this time. So I think what we need to do is to, apart from personal hygiene that we need to be, to bring up, we also need to...
Of course, we'll come to, you know, what we need to do in terms of prevention and, of course, management. But let me take it to Emmanuel right there in Abuja studio. Like it's been established here, Lassa fever is predictable because it comes every, you know, between January and April of every year. And yet it seems the NCDC, not NSCDC, NCDC and the health authorities are not able to actually, you know, put preventive measures in place. And then maybe you want to speak to the issue of 4 labs across Nigeria. Of course, your DG did talk about, you know, last year it was just 2, and now there's an improvement of 4. Is that enough for a country of 200 million people?
Thank you for the question, Ngozi. You know, the Nigeria Center for Disease Control was established by law in just last year in September, although there's been a lot of work that's been done over the years around Lassa fever. And in fact, just last week, we had an international conference, the very first ever Lassa fever international conference that was hosted by the Nigeria Center for Disease Control with support from partners. And, you know, what Prof says is what was discussed. And the reason why that conference was held was because after 50 years, we've not been able to do enough, or enough has not been done, or enough has not been known about Lassa fever. Lassa fever is a condition that before now has been presenting as outbreaks, but we're beginning to look at the epidemiology a bit more clearly and understand it to see that there is some level of endemicity. So those were the discussions that were had at this global conference that we had people from over 18 countries. Contrary to what has been said, there's a lot that's been done. A lot needs to yet to be done, but there's a lot that's been done for the control of Lassa fever. So last year as well, after the outbreak that happened, there's been a lot of work in setting up research into vaccines and innovations to address Lassa fever. So one of our global partners, CEPI, which is the Coalition for Epidemic Preparedness, is investing money into research to look at how can we treat Lassa fever better, as well as, you know, vaccines into Lassa fever. With regards what my boss talked about, the labs available for diagnosis of Lassa fever, there's a lot of work that's been done around diagnosis. So at the moment, the way that Lassa fever is diagnosed is through a molecular test. So it's a polymerase chain reaction. And it's not a test, it's a complicated test, a molecular test. And therefore, the fact that we have this capacity at 4 laboratories means that we can actually reach the country. You don't need to have a PCR lab in every, it's ideal, but for these purposes, what we've been able to do is that while we don't have PCR labs in every state, there is a mechanism in place where if a sample is collected in any state, the sample can be transported safely and securely through the mechanisms that have been put in place to these laboratories where these specialized tests can be done.
What is the average travel time, for example, if there's an outbreak in Maiduguri and you have to take the samples to a place like Irua in Edo State? What should ideally be the travel time for it to remain safe so that you can actually get the kind of diagnosis that you need?
So it starts from making that diagnosis, actually starts from the clinician. So like we've been saying, let doctors have a very high index of suspicion, a low threshold to make a diagnosis. If you have a patient who has malaria, is not responding, is having any other features like, deranged liver function tests, deranged bleeding function tests, and you think that it might be something else, at that point, make a diagnosis, take a sample. So these labs that have been established are located in the areas that we have found to be hotspots. So in the last outbreak, 80% of the cases were found occurred in Oyo, Ebonyi State, and Edo State. So we've been able to establish a lab with support of partners and the federal government, a lab in Owo. There's a lab in Edo State in Irua. There's a lab in Ebonyi, and there's also a lab at the National Reference Laboratory here in Abuja. And therefore, where the hotspots of the cases are, there is access to treatment and to diagnosis as soon as possible. A few of the things that also have happened this year, like we know we're understanding that it has a seasonal pattern, is that even before this happened this year, teams have been deployed to those states. Emergency operation centers have also been established in those states so that you have a collegiate and an integrated way of responding to these outbreaks. So you have people from various pillars, risk communication, case management, infection prevention and control, who now work together at this in these EOC centers with our colleagues from Abuja here to look at cases. If you are a suspected case, there's a process for doing contact tracing. So we go to your homes and look at what is happening in terms of whether other people are at risk.
Okay.
This is especially, yeah.
All right, Emmanuel, we'll come back to you. Let's bring the professor in here. Yeah. Now, Lassa fever manifests like normal malaria, where malaria seems to be one of the commonest illnesses around. Everybody has something, you go, it's malaria. The moment you have temperature, it's malaria. The moment you have, you lost your appetite, it's malaria. But when you get to the hospital, for instance, with the feeling of malaria, and there is the advice from the CDC or the NCDC that tests should be carried out to detect or differentiate between malaria, whether it's regular malaria or something else, especially to bring out Lassa fever. Our regular hospitals, the clinics and the hospitals around us, do they have what it takes to detect that? If anyone just comes with that symptom, talk to us about that.
Yes, I think, thank you very much. Most private hospitals that I know, let's not talk about government hospitals because they are very few and far between, but private hospitals that are standard, at least in Lagos that I know, are capable of diagnosing malaria, typhoid, so it is very possible. But the problem is...
They diagnose Lassa?
No, they can't diagnose Lassa.
That's the point.
You have to screen out malaria. When you tell someone that it's not malaria, it's not typhoid, and it's still having some symptoms, non-specific symptoms like we have in Lassa fever, then you begin to think of something else. So it is very possible that most of these private hospitals can screen for malaria and typhoid. Okay. But the problem from my experience, is that many patients, when they come to you and present to you, they already made up their mind, I have malaria. They just say, please, I have malaria. I want to carry it. No, don't. I don't
just give me the drugs.
Just give me drug. Some of them
sometimes they go to self-medicate, get the chemist and the pharmacy and buy the drugs.
I think we need to instruct people. We need to inform people. We need to do community cultivation. That it's not everything that looks like malaria is actually malaria.
Now, Professor, if you go to states like Benue or Kogi State or Taraba State, for instance, up until now, people still eat rats.
Oh, yes.
So, and rat is one of the hosts.
Delicacies.
Exactly. It's a beautiful delicacy in
Yeah, I know I did
okay,
it. I did.
Fine. If you go there,
Yes.
rats are beautiful delicacies for some of the people there, as the case may be.
actually. Yes.
Now, looking at that, what risk or how does it come?
Even Dr. Nigbide is...
Prof is even laughing, you see?
Because I ate rat when I was growing up.
Growing up, actually, you've never tasted rat. Oh, okay. No, but there's a certain one that is eaten. That is not all rats can be eaten,
Yes.
as far as that is concerned. But coming to
those who
the real
live in
issue,
the village,
yeah, those who live in the villages and all that. But how does that compound the issue, really?
You see, actually, we must try to educate the people to run away from eating rats. And all still boils down to the same thing, poverty. If it's because of poverty that a lot of these people, I mean, people eat rats, they eat cockroaches and all that. But
in China, they eat cockroaches.
well,
But they breed cockroaches. Yes.
You really had to go there.
I don't know, of course, yeah, it is.
But you see, it's not all these rats
Yeah.
that actually are hosts to Lassa fever virus. Not all of them, but you do not actually know which one is infected. It is multi-mammate rats, all those rats that have multiple breasts.
Yes.
Those are the ones that are very delicious.
Now you have just finished the whole matter.
Prof has finished it.
Let's bring Emmanuel back in here, to share in this. Emmanuel, I wonder if you are able to tell the world that you've actually partaken of this delicacy, according to... yes, it's a multi-mammate rat that is responsible for, carrying and spreading this Lassa fever. But, just like my colleague Mike mentioned, there are people everywhere in different parts of the country, including my village, actually, who eat rats. I mean, once it looks, big and all
exactly.
that, they just
Beautiful.
go for it. How are you able to tell which one is a carrier and which one is not, really?
Okay. Well, it's interesting that, this issue of rats is coming up. I'm a Bedouin man myself, and, it is a delicacy where I come from. So we can't run away from that. And interestingly, at the conference last week, on a serious note, there were 8 tracts that we looked at. And one of the tracts that we had was a tract on the human-animal interface. So the emergence of zoonotic diseases, a lot of the diseases that have happened in the last few years, the outbreaks, have been because of this change in human-animal interface. So Ebola, for instance, Lassa fever, all that really arises from that close relationship between human and animals. Having said that, the abstract that I was talking about was one that looked at the contribution of ingestion of rodents to food security. And the study actually found that the evidence to support what Prof was saying, that the most vulnerable households rely on rodents for their protein needs. And therefore, we need to look, so that is also a factor. Having said that, the exposure that foodstuff have to the urine and to the feces of rats is also because of the way houses are structured. So houses, a lot of the homes of Nigerians is not well protected against rodents and rats. We don't derat our homes, and you have very dark huts where a lot of people live in. So the structure and the type of housing and all that is also important. And then, of course, people spread food, gari, and so on the roadside to dry this time of the year. So those practices are to be discouraged. Putting food in containers that can be closed up properly are also very, very important. So on the rat issue, we can't say don't eat rats or rodents, but it's more, but if you're gonna eat, you need to make sure that it's well prepared. But also we need to move to sustainable ways of growing rodents. There are grass cutter farms and so on, and we don't need to get our brothers to go and burn the bushes and catch the wild ones. So,
yeah. But Emmanuel, let me ask you.
That's a business opportunity for someone.
Yeah, Emmanuel, let me ask you. For instance, like in villages where they eat rats. Rat is a delicacy in some of the villages, even in Ngozi's village. He said, even like in your village you mentioned, maybe in Oju or maybe in Igede or in Bajimba or anywhere, especially like in Benue. Is there a link between the consumption of rats and the prevalence of the Lassa fever generally, from what you have studied?
Okay, again, that's a very interesting question. And I would run away from calling too many village names. but the studies, in fact, the last outbreak, there was an interesting metagenetic analysis. So this is an advanced technology where we were with partners abroad and in Irua and at the Redeemers University, studies were done to look at the virus and to see where did it come from. Was the virus, where did the new outbreaks happen? How did they happen? And the studies showed that the majority, well over 90% of the cases, apart from the few ones we had in health workers, came from the rodents onto human beings, affecting human beings. And therefore, we know that there are those hotspots that exist. Interestingly, if you look at the map, the hotspot of cases have remained within 3 states. And there are 3 lineages, not to go into too much of the science, but there are 3 lineages, but there are 2 major strains, if you like, or lineages of the virus that are quite active. One around Ebonyi, and then one around the Ondo axis, Ondo-Irua axis. So that is what we have found from the studies. And this study was published in the Nature journal, which is one of the most advanced journals in the world, and really gives us better insight into what is really happening with Lassa. And going forward, these technologies will be applied to our understanding of Lassa fever.
Okay.
And the outbreaks that are happening.
All right. Back to Dr. Onigbede here. 16 out of 60 cases. 16 fatalities already, just this year alone. Of course, NCDC has declared an outbreak. Is this an emergency that we really should begin to worry about?
Absolutely. It's an emergency. As far as I'm concerned, I think it's an emergency. 16 out of 60. Usually the mortality of Lassa fever is about 1%. But the rate at which this is going above that. So I think it's an emergency.
So how do we now begin to protect ourselves as individuals, as communities, from this outbreak?
We try to highlight it. Number one, we have to up our personal hygiene. And like he rightly pointed out, all our utensils must be properly kept. Food items like rice and all those things should not be exposed. Because this is to be fair on the community. It's not so easy to keep rodents from coming to the house.
Isn't that where the state should come in?
Oh yes, I know Lagos State in 2007. Was this last year or 2017? Lagos State was saying they wanted to eradicate.
It was 2017.
Okay, they wanted to eradicate.
There was a war declared on rats.
War against.
I wonder how whether the war was won.
Obviously, it hasn't been won because there's
now have a
emergency.
Yes. Yeah, even if Lagos State was able to eliminate all the rats in Lagos, as if that was possible, what of the rats from Ogun State?
Yes, and the rats from Benin Republic.
Yes, they don't know.
As a matter of fact, a place like Lagos should be more more concern. I mean, 20 million people, and in many areas, when you look around you, you don't. I mean, you can already imagine the seriousness.
Quickly, let me ask Emmanuel in here. How long does it take? What's the gestation period when anyone comes in contact with the feces or the urine or rats, and when it begins to manifest?
So. The incubation period is anything between 10 to 21 days. And like we said, there are two major modes of transmission that we know. So one mode is transmission from the animal to humans, and the other is from humans to humans. So the human to human happens when you take care of or you're in contact with, with the vomit, urine, or blood or feces of someone who is affected with the condition. And to bring you a little bit back to the mortality, the conference we had last week also highlighted, we had colleagues from across other countries in West Africa. You put the map up, from Sierra Leone, Liberia. We had them, and Guinea. We had them at the conference as well, sharing experience. And the mortality is quite high in those countries. And on average, unfortunately, the mortality in the cases that are confirmed has been around a quarter, thereabouts. And the plan going forward, with the support of the government and NCDC and partners, is the development of a Lassa fever plan. And the plan is that in the next 5 years, we will aim to move the mortality rate to less than 10%. And that means that all we're talking about, people to think about Lassa where they have a case that they're not sure of, is so important. Mm-hmm. And also ensuring that they get the treatment when they need, when they get the treatment early, and doctors and clinicians having a high index of suspicion will ensure that the mortality rates are much less than what we're seeing.
Okay, we have to leave you here now. Emmanuel Agogo, Deputy Director, Prevention and Program Coordination of the NCDC, thank you for coming. And Professor Joe Nigbinde, Managing Director, Rofeka Medical and Dental Hospital, thank you for coming as well.
Thank you very much.
Thank you very much.
Right.